Good afternoon, everyone, and welcome. This is Ruth Christopolsky, Senior Vice President of Population Health for Atrium Health, and we'd like to welcome you this afternoon to our Return to Work Town Hall Part 4, and to wish you a happy, sunny June. We have a great panel of guests with us today. Dr. Katie Passaretti, who leads our infection prevention, is with us. Dr. Dave Cosenza, who's the Specialty Medical Director for Employer Solutions and our on-demand telemedicine, is here today. Angelo Albero, our Chief Advanced Practice Provider in the Employer Solutions space, is here, as well as Grady Hardiman, our Director of Employer Solutions. So we're very, very pleased to be with you here today. Our goal today really is to spend some time in 3 different areas. First and foremost, we want to give you information on new guidance and updates. We're going to spend some time in a roundtable discussion on lessons learned from some of the worksite exposures that we've supported to get kind of the ins and outs of what went well and what didn't, and some best practice sharing on what you might want to think about as you're thinking about return to office and return to your historic work environments. And then finally, I'm just going to wrap up with some information on a resource guide that we've been developing. As you know, we want to make this information available to your teammates and peers. And so today's meeting is being recorded, and we will send out a link to that recording at the end, right after the presentation, so that you can share. In addition to that, as we're going along, if you have a question, please feel free to submit it to RTW COVID-19 at atriumhealth.org, and we will do our best to respond. Or we do have the live chat feature available during this website or this webcast, and you can actually type your question in, and we'll try to have somebody respond live. First up, I want to introduce Dr. Passaretti. She is going to give you some new guidance and updates that are occurring as a result of COVID-19. So passing it along to you, Dr. Passaretti.
Thank you so much, and thank you so much for giving me a chance to update the group. So I'm going to go through a little bit of an update on where we stand with cases and trends in the Charlotte area, and talk through some of the testing changes that have occurred, both for diagnostic and antibody testing, and considerations for y'all to think about as we move forward. So this first slide is just taken straight from the North Carolina data, showing the trend in positive cases over time. You can see this was from this weekend, but we're up to about 30,000 positive cases now. And while we expect to see increases in cases as we are doing, obviously more and more testing, the rate of increases here over the past couple of weeks has been on the upward trend. So not just, we had been plateauing, and we're starting to see a bit of an uptick, which isn't completely unexpected as we start mixing more in society, and some of the stay-at-home orders have been lifted. Next slide, please. Unfortunately, so this is a report from Homeland Security that came out a couple of weeks ago now, but just showing some of the locations with increased cases and locations to watch. So just to point out that Charlotte is on that list of locations to watch, and that we need to kind of continue to keep an eye on everything very closely and make sure we're doing our best to prevent a steep increase in cases that could potentially impact our healthcare system, and just kind of highlights the importance as we reopen of doing all those things you all have talked about, washing our hands, making sure we're hammering home, social distancing, masking. All of those interventions remain very, very essential. Next slide. Just for a little bit, so as I mentioned before, just increase in positive cases isn't super helpful, right? Because as you test more, we're going to find more. The other data point for you all to take into consideration as you're looking at the numbers is the percent of positive tests. So, again, in addition to kind of more cases, we're seeing the percent of test positive climb as well. So we had been around 10%, came down to around 5 or 6% in North Carolina and Mecklenburg County, and the percent of cases has been increasing right along with the total number of cases. Again, suggesting it's not just we're testing more, but we're also seeing a little bit of an uptick in transmission. Just a little review of demographics, as that may vary for different employers. It's been well published that underserved populations, underserved areas have been hit harder with COVID, similar to other kind of diseases we've seen in medicine in the past. In particular, in the Charlotte area right now, we've seen a pretty large increase in cases, particularly in the Hispanic population. So just something to consider for as you kind of assess the risk in your employee population. And then, of course, older populations are more, and people with other medical problems are more at risk for hospitalization and more severe complications. Next slide. And, case increases is one thing. The other measure that we keep a close eye on is the trends with regards to hospitalizations, ICU beds, to make sure that even though we're seeing increased cases, that we have the capacity within the healthcare system to be able to care for those patients. And we're seeing similar trends in hospitalization that we're seeing with cases. So increased COVID hospitalizations, although I will say that the numbers of patients hospitalized in our intensive care units across the state remain within manageable levels, that hospitals aren't being overrun with cases. It's we're holding steady, although the number of patients is increasing. Next slide. So I'm going to switch, so that's just kind of background. I'm going to switch and talk about testing, and I'm going to talk both about PCR or testing for diagnosis of COVID, as well as antibody testing or antibody testing with the intent of showing potential immunity or protection against future infection. So just to walk through some of the differences. So for diagnosis of COVID, the primary test we're relying on right now is a test called PCR, or polymerase chain reaction. And it really reflects that person's infection status at that point in time. So if I'm infected today, I get a nasal swab for PCR. It says either yes or no. I am infected right now. It doesn't predict what's going to happen in the next days, weeks, whatever. So it is really a snapshot at a point in time. Antibody testing is looking for antibodies to COVID-19 suggesting prior infection, and we'll talk through that in a minute. With regards to diagnosis of COVID, the CDC, DHHS, and within Atrium, we've all updated testing criteria to try to make sure that we're capturing everyone, can do contact tracing, and as a key component of preventing spread within our area. So symptomatic, that type of testing is divided into symptomatic, testing people with symptoms of COVID, and then high risk people without symptoms. So in the symptomatic testing category, initially testing was focused on those with fever and cough or shortness of breath. Those symptoms have been expanded to include sore throat, headache, new loss of taste or smell, chills, and muscle aches, to really try to capture people even with mild symptoms, which is often the way people present with COVID. In addition, for patients even without symptoms, the current recommendation is to do testing for individuals who are close contacts of known positive cases. So close contact is defined as exposure for 15 continuous minutes in the absence of appropriate personal protective equipment. So masks in the community setting is the most important piece there. Close contacts may include household contacts, workplace contacts, or community contacts. The other component that has changed with regards to testing, and I wouldn't say really changed, but that's being re-emphasized, is that we have to ensure that all populations have access to testing. So if you meet those criteria, those individuals are able to be tested in a reasonable time frame. It's probably most important for individuals who are in high-risk settings like long-term care, homeless shelters, or jails, individuals at high risk for severe illness that I mentioned before, for healthcare workers and first responders, and as well for your all's purposes, frontline and essential workers in settings where social distancing is difficult and at times impossible to maintain. So that's just a brief update on some of the changes in diagnostic testing. I want to switch gears a little bit and talk about antibody testing and what we know so far, since that's a relatively new test. Before I do that, I just want to talk through a brief kind of statistics lesson in sensitivity and specificity and why that matters in particular for antibody testing. So you hear these terms thrown about. Sensitivity is a measure of true negatives. So if something is perfectly sensitive, every negative test that comes back can be trusted. So a test with low sensitivity, you run the risk of false negatives. Specificity is a measure of true positives. So if you have low specificity or imperfect specificity, then you run the risk of false positives. So different tests, you have different priorities as far as your threshold for being okay with missing a test or calling a false positive. For antibody testing, where this plays in and where it's particularly important is that for antibody testing, the intent of this test is to show that you have been previously infected, and the hope is that it represents whether or not you're immune to infection in the future. In that case, it's very important, right, that you don't get false positives, because you can see a model where once we get more comfortable with this test, individuals are told that their behavior can change if they're antibody positive. So, you know, this is where that concept of immunity, passports, all that you hear about in the news has been kind of laid out. So just kind of a little bit of update on the currently available antibody tests. Initially, a ton of antibody tests were put out on the market, and a number of them had to be pulled back because there were concerns about how well those tests really assessed what they were intended to assess. So the FDA pulled back many and have now released ones that have had at least some degree of vetting under emergency use authorizations. And I included the link on this slide to which antibody tests are currently approved for any kind of use by the FDA. Again, we're still very much learning what these antibody tests mean. So the antibody testing looks for antibodies that the body creates to fight an infection. There are different types of antibody testing, some that look for early antibody response and some that look for late response. The late response ones are called IgG, and that's what we typically look for as a measure of whether the individual has potential immunity or protection against future infection. I will say that, you know, presence of adequate levels of IgG antibodies can indicate immunity for some infectious diseases, but we're still learning what that means for COVID and how long that immunity can last. And the duration of protection or immunity can vary by type of infectious disease. Next slide. So there are some potential pitfalls that are worth being aware of with regards to antibody testing. And, you know, we're learning every day and we'll continue to learn more and feel more comfortable with how best to interpret these tests. You know, we are still learning what antibody levels are high enough such that the individual who tests positive is considered protected. You know, whether that protection is true and for how long is something that also we're still learning about. And then whether you could have antibodies and still have the ability to transmit infection, especially if the test is done early on after symptoms. The recommended time frame is to wait at least 3 to 4 weeks after symptoms of infection to use that antibody test. The ways to minimize false positive antibody results and have better faith in that test is to make sure that the type of testing platform you're using is very specific. So to the, you know, statistics stuff we talked about earlier, and then testing populations with a higher likelihood of having positive results is important. When you test a population that's, you have a low kind of what we call pre-test probability, you have a much higher risk of having false positives. So populations that have a higher likelihood of the test being useful are those who more than 3 to 4 weeks ago had an illness that was suggestive of COVID, in those populations that are high risk for prior exposure. So healthcare workers, essential workers, especially if there was concern about sick individuals being in that workforce, first responders, and household contacts of known COVID patients. This is just a graphic from the New York Times and just kind of outlining where the antibody kind of discussion plays in. So you've heard in the news about something called herd immunity, and this essentially means enough of the population has been infected or is protected against future infection that you can stop that train of transmission. So I'm infected, but 5 people in my office, or I'm immune, 5 people in my office have been infected previously, and they kind of stop me from transmitting it to other people in this general area. In general, it's thought that we need at least 60 to 80% of the population to be immune to achieve that herd immunity and prevent spread in our area. I thought the New York Times graphic did a good job of laying out, there have been locations that have done wider scale antibody testing. And you can see some of the locations, but none of them have any more than 20% of the population with antibodies. So, even in areas hardest hit, there's still, by this measure, a huge chunk of the population that's still susceptible to infection. Next slide. And I think my last slide, just a little bit about Charlotte specific data. So, we're still relatively early in this area in kind of evaluating our antibody testing results, but currently we're finding only about 4% in this area are positive. So that's, if, that test proves to show that, individuals are immune or protected against future infection, which is a big if, there's still 95%, over 95% of our population who, by this measure, still are susceptible to infection. So right now, still a lot of people with potential for infection. Just again, very important that we keep those measures to prevent spread of infection at top of mind in all our settings. And I think that was all I had to say. Thank you very much.
Well, thank you, Dr. Passaretti. As always, very, very helpful information, up-to-date information also. And, when we think back to the places that we heard were hardest hit that have done full-scale testing, it's interesting to see from an infectious disease standpoint, it's still a relatively low prevalence of individuals that have been exposed. So still an environment where it's important to be safe and that we continue masking and hand washing and social distancing, as we've been promoting all along. Our next part of the program, I'm really excited about because I love panel discussions, and we're gonna do a panel discussion, and along with Dr. Passaretti, Dr. Dave Cosenza, Angela Albero, and Grady Hardiman are going to join me, and we're going to talk a little bit about lessons that are learned from some of the worksite exposures that we've already supported. And we've been serving now, it feels like probably 9 or 10 weeks from our very first exposure that we supported. But we have been supporting employers across the Atrium footprint as they've had individuals who have tested positive in the workplace. And really thinking with them about how do we guide them through the challenge of managing not just the patient themselves, but all of the other individuals who've been around the patient. And then we've done that more than a dozen times over the last several weeks. So we've seen some consistent questions and themes. And so we wanted to bring you some of these interventions. And so we're going to start with Grady. We're going to ask him the very first question. And, for a long time, we've all heard, probably since we were kids, it's better to be safe than sorry. Have we seen, or have you seen, Grady, instances with worksite exposures where an employer that you worked took an overly cautious approach, sometimes beyond what might be recommended under the CDC or other guidelines? And if so, what were the potential consequences of those actions? So Grady, gonna have you start with that question.
Sure, Ruth. That's a great question, and the answer is absolutely, and we continue to see that today with some of our employers and partners in the community that are reaching out to us. And what we're really finding is that one of the things that sticks out is employees and employers who sort of have this initial reaction to their first COVID positive in their workplace, and as we've always said, it's not really a matter of if it happens. It's a matter of when it happens. But when that happens, they tend to reach out and they want everybody that was in the building tested. We need everybody tested. We need to make sure nobody else has it. And that really kind of goes against that initial recommendation from a testing perspective. So what we've been able to do is really work with these employers and provide some education and some guidance on actually who probably needs to be monitored and who was actually exposed and what that means. And then from there, determine who actually needs testing and who doesn't. Really the consequences of what they were wanting to do with testing everybody, can really impact their bottom line from, overflowing the healthcare system for this testing. And then as well, it's an uncomfortable test. It's not something people are really excited about doing, is having that nasopharyngeal swab. So just encouraging the employers that this is not a comfortable test. It's not something that your employees would be happy about doing, especially if they're asymptomatic and they're not sick and they're not feeling bad, just simply because someone in the building tested positive for COVID-19. So that's really one of the biggest things that we're seeing and we're hearing from some of our partners, that when they get that first COVID positive is that initial knee-jerk reaction to, okay, we have to test everybody in the building, everybody that works for us, whether they were here or not. And we're still continuing to get some of those questions. So it's really the educational component and guiding them through that process of helping them identify who was truly exposed, how do we monitor these folks, and how do we determine at that point who needs testing and who doesn't.
And Dr. Cosenza, I know you've had some experience in this space also, so I didn't know if maybe you wanted to provide an overview of some of the calls that you've gotten and the questions that you've received in this space.
Thank you, Ruth. I would definitely agree with what Grady said. I would even add to it that sometimes there's an expectation or belief that a negative test means that all the restrictions, all the quarantines, that they're quote unquote safe to return. And the reality is, as Dr. Passaretti pointed out, doing the current PCR test means that on day 4, the virus was not detected to a level the test could find, but that doesn't mean that on day 7 somebody won't become symptomatic. So when we're getting into the testing of the asymptomatic people, the people that have been in that close contact definition, we need to recognize that the negative test does not remove any of the recommendations of, ideally quarantine at home for 14 days, or if they're an essential worker, making sure that they work in accordance with the guidelines that the CDC has put for essential workers to continue to work. So that, and as Grady said, the kind of desire to test everybody, those are the two biggest things that we kind of have to talk employers through to get them to understand exactly who should be tested and what actually the test means if it's negative.
Well, thanks for that. So we do know that the best course of action, if possible, is to quarantine the individual that was exposed, and then if they are an essential worker, to ensure that they're masking and covering. And I know we're going to talk a little bit about that later. So I'm going to go on to my next question, and I'm going to start with Grady. With most of the worksite exposures that we've encountered so far, did the employer have an existing plan in place to address the person who was sick and the continuity of operations. Can you address that?
So I think yes, employers, they've had their typical sick leave plan, and I don't think that really included, for any 14 days straight where we would potentially ask someone to be out of work to continue that continuity of operations. I think this is something that will help change that moving forward in the future, and it's certainly something that is recommended, is that, taking a look at your workforce and understanding how you can cross-train individuals to step in and pick up where someone else has left off, because having that plan will be important, because when you ask someone to quarantine or stay at home, and really encouraging them and being sincere about staying at home when you're not feeling well, staying at home when you're sick. Of course, operations still need to continue, and having that plan in place will be key for those employers to continue to moving forward with the jobs that need to happen. And then the second part of that is just the plan for how do we address these exposures moving forward, and that's where we've been really able to partner with some of our employers from a worksite exposure management plan, and kind of like I alluded to earlier, is helping them really identify those individuals who have truly been exposed in the workforce. How do we get them the care they need? How do we monitor them and keep them at home for that 14-day period until it's safe for them to return?
Thanks, Grady. Angela, I know you've had some experience in this place with planning for the work sites that you work with. I'd love to hear your thoughts on, having a plan and the benefits of having a plan early on.
Sure. Thank you, Ruth. It's definitely, I think, as is the case for everybody throughout this whole pandemic, been the case that in the beginning, plans were few and far between, basically because this was new and unknown. And as time and experience have progressed, more and more people have had an opportunity to learn from their previous experiences and implement plans. And I've had some experiences with some employers who have done exactly that and learned from their previous experiences and now have a plan in place for when an exposure occurs. And I do feel that is extremely important to do, more so because it gets those employees feeling confident confident that if something should occur in their workplace, it's going to be managed quickly and efficiently. Not only that, it helps prevent further exposures down the line. For example, in the beginning, when those plans were few and far between because it was so new and we just didn't have the opportunity to have those plans in place, there were certain examples of employees who weren't connected to a healthcare provider or set up with an exposure kind of consultation until a few or more days into their exposure, which potentially led to additional exposures, kind of a domino effect in their workplace. Whereas now with some of the employers who do have a really efficient plan, get connected almost immediately, same day or next day after an exposure, we can make sure that those important precautions are in place and well communicated to the employees, making sure that everyone is following their appropriate guidelines that they should be, and doing our absolute best in conjunction with the employer and the employee to prevent any additional exposures in the workplace. And the sooner that all that work can happen and discussion and guidance can happen, the better we can do at reducing overall exposures throughout their departments.
Thanks, Angela. Again, everybody learning from each other as we're developing best practices. I'm now going to ask Dr. Passaretti, whose face is on everything and phone number is across the world. So she's getting reached out to by a lot of individuals. What are some of the most frequently asked questions you're getting from employers when they reach out following an exposure? And then what kind of answers do you give them when they're asking questions?
Yeah, so some of it you hit on before, who exactly needs to be tested or, taken out of the workforce or whatever. Do I need to close down when there's a case? Those kind of questions come regularly. And I think, Dr. Cosenza and Angela and Grady handled some of that before. The other one I kind of add to that is we frequently, when there's a positive a person with COVID in the workplace get questions about when that individual can safely return to work. And probably the most common situation is that they get referred for repeat testing. And I just want to kind of talk about that for 2 seconds, because I worry about the impact on the worker themselves without, real clear benefits. So the CDC currently does not recommend workplaces, especially those outside of healthcare and whatnot, repeat testing before the individuals return to work. There's a couple of reasons behind that. As I mentioned before, the type of test we currently do for diagnosing COVID is something called PCR. So that particular test is very good at picking up the virus, but it can pick up the virus even after it's dead. So when people who spend their time, looking at the characteristics of this virus and studying it, do tests that look at whether those individuals where the PCR test is detecting virus can still actually spread to other individuals, that really by the 8 to 9 day after diagnosis or after symptoms have started, those individuals no longer seem to be good at transmitting infection to others. And unfortunately, when you test with the PCR test, we're finding individuals who, detect lingering kind of dead virus for up to 6-7 weeks. So that, by using that test base, A, you're probably not preventing any transmission in the workplace, and B, this individual is then out of work for, at times, very long periods of time. So I would just kind of point out that in the CDC guidance that, we don't really recommend test-based. The recommendation is 10 days and at least 72 hours without fever, off meds, and, other symptoms improving is what, we're trying to guide employers to as far as letting someone with COVID come back to work.
So thanks for that. Dr. Cosenza, do you have anything else that you think we should share for this question? Because I know you've dealt with a lot of employers.
Yeah, no, Dr. Pess already hit the main point, which is the test is unfortunately may keep somebody out of work who's no longer infectious. And one of the people had made a question in the comment, or the question and answer, about it is not a pleasant test. So if we can spare people's noses from this test who don't necessarily need it and don't benefit from it, that is certainly something to strive for.
Wonderful.
Can I throw one more thing in, Ruth? I'm sorry. I'll just add, so the other thing I get a lot is like environmental cleaning questions, like should I buy UV light machines, or should I buy, hydrogen peroxide sprayers or things like that. There's all sorts of kind of technology out there. And, that comes up frequently when there's someone in the workforce. And I would just say, those things are fine if you want to invest in them and may provide some slight added benefit, but really the focus needs to be on regular routine cleaning practice and making sure that that's happening all the time, not just kind of swooping in and saying, okay, I'm just going to get a UV light machine when I have someone that was positive in that area, or I'm going to decontaminate it after the fact. The important part is that preventive part and getting those practices into place so that your cleaning service is really hitting those high touch surfaces with just good basic cleaning.
Thanks for sharing that. Dr. Cosenza, you're our go-to person typically when we get a phone call. So what are some of the common themes that you've seen across the exposures that we've managed up to this point in time? So
a couple of things have become kind of common. One is that an employee was at work sick. And so obviously the best way to do there is try to really have a policy that encourages them to stay home. And then the other was that the social distancing and mask wearing recommendations aren't followed, even to the point where, like, at common areas when people sit down to eat together, I mean, you have to take your mask off to eat, that's understood. But people need to be mindful that the best way to do that would be to eat in staggered shifts or try to separate as much as possible. But those have been kind of the common things and the exposures we've been asked to kind of help consult with employers. Is somebody was sick, and then others got exposed because the recommendations weren't followed to try to prevent transmission. And if people were curious, the mask actually protects the person who is sick from spreading it to a much better degree than it does those who are not sick from getting it. But if everybody's wearing masks when somebody is sick, that they are less likely to be spreading it, and any other people have an additional layer of protection.
Thank you, Dr. Cosenza. We're going to go to the next question, and I'm going to just do a little bit of an introduction, and then I'm going to ask Dr. Passaretti to respond. So in healthcare, you know, we were kind of on the front lines with regards to ensuring that we have a safe environment for our teammates and our patients. It's really important since we're dealing with people who are sick, many who are immunocompromised and in those high-risk groups. And then we're also in an environment where we're caring for COVID patients. And I can say that I believe we've done a tremendously wonderful job of educating our teammates, you know, across all of our locations about the importance of things like washing your hand and wearing masks and all of those kind of things. And yet we still have exposure. So Dr. Passaretti, I know you talk a lot about this with our teams internally, but you know, what are the top 3 to 5 things that you think not only we at Atrium can continue to do to ensure that we're, you know, not inadvertently exposing others, but what could our employers do also to help prevent exposure?
Yeah, so some of the themes are common to what Dr. Cosenza just mentioned. You know, our healthcare workers tend to be very good about wearing their personal protective equipment, being vigilant right now when they're interacting with patients. So, you know, that's very much top of mind. Where we see gaps are really when the workers are interacting with each other. So those break times, those, you know, when people are doing desk work and they, you know, they're tired of wearing their mask and they take it off. So it's really, you know, the thing we keep coming back to is the need for vigilance throughout the day. And this applies honestly even into the community. You've got to be washing your hands. You've got to be wearing that mask unless you're eating, and being aware of how close you are to other individuals, because those things every time kind of increase your risk. And you know, it's devastating when you see that spread in your own workers from person to person, and could have potentially prevented it. So really hammering home and being vigilant and not kind of slipping back into old bad behaviors is what I kind of harp on time and time again, because that's the best way to prevent issues in the future. You know, we tend to be reactive rather than proactive, and it's very hard to maintain these behaviors given that we're in this for the long game. But good leadership, good communication, and just constant reminders are probably the best way to go.
And Angela, I know that this is a topic near and dear to your heart, and I know that you had some additional information that you wanted to provide on masking.
Yes, thank you, Ruth. I agree. I think the masks, as has been stated before by Dr. Cosenza and Dr. Passaretti and Grady, are extremely important to helping to prevent exposures, and even more so in other work environments than healthcare, where people may not have had exposure or experience previously to wearing masks. Just as important as the use of a mask or a face covering in and of itself is knowing how to use it correctly. Because the best tool or preventive measure is only as effective as its use being used correctly. So it's really important to make sure you do take some time, spend some time educating employees as best you can on how to correctly use masks. And there are some resources out on the web that can help with this, but things that help is ensuring that when you're wearing a mask, it covers both the nose and the mouth, and kind of creating as best a seal or contouring to your face as possible, making sure that before you put on your mask, you're washing your hands so that you're not inadvertently contaminating your mask. And similarly, after you're placing on your mask, washing your hands again, trying to avoid as much as possible touching the mask while you're wearing it again, so that if there's any contaminants either on the mask or on the hand, you're not cross-contaminating between those two surfaces. And most masks that are worn with ear loops behind the ears, or even the ones that are with a tie. The best way to handle a mask is with the loops or the ties themselves, not by grabbing it by the front and removing it. So, using a finger to kind of loop behind the ear loop and removing it from one side to the next without touching the face or other potential surfaces, again, to minimize cross-contamination. And then similarly, seeing some fun and interesting ways, so sometimes that people can wear masks while keeping them on and behind their ears, but bringing them down under their chin or just hanging off of one ear. Some of those things, again, can lead to cross-contamination and render the mask ineffective. So it's really important not only to encourage the use of masks or face coverings, but also to encourage the use of them correctly.
Thanks, Angela. And I know that we have a infographic on how to wear a mask correctly, and we'll make sure that that's available to all the folks on the call. But wonderful information, and I learned something also that I need to remove it from the ties versus from the front of the mask. So I'll remember that. Our next question is we talk about what's not going well. So we're going to talk now about what is going really well. And I'm going to ask Grady first. Grady, what's the one thing that you see that most employers seem to do well after the exposure occurs?
Thanks, Ruth. The one thing that really stands out to me that I feel like a lot of our employers are doing well is they're reaching out and they're asking for help. They're taking it seriously, and they understand, the ramifications of what that exposure could be for their employees and their workforce. So when I think about the one thing that most do is they reach out, they try to find that trusted partner that can help guide them through that process. There's lots of information out there. Some's good, some is not so good. And the one thing we really pride ourselves on here is making sure that we're providing good, transparent information to help our employer partners through this exposure. So them reaching out is probably one of the most essential things they can do after the exposure occurs, is to reach out and get help.
Thanks, Grady. And Dr. Casanda, I was wondering if maybe you could talk a little bit about how we help an employer once they reach out to us. Like, what is the process? And Grady, you can sure jump in also. And I know, Angela, you've also managed several exposures. Someone want to talk through the process of, how Atrium is helping the employers with the exposures?
Sure, Ruth. So as Grady said, employers have gotten really good about raising their hand and reaching out to us. And I would even add to that, to Grady said, most of the employers have figured out that they need to make sure that the sick employee goes home quickly. And then you start trying to figure out who they've been around and start kind of quarantining those. What we are kind of trying to help guide them on in particular is who is really the high risk contacts. The CDC has changed their definition of what a high risk contact was. It used to be 10 minutes, 6 feet. It is not that anymore. Generally, it's considered less than 6 feet for 15 minutes without appropriate PPE. It can be as short as 3 seconds if an infected employee coughed directly into somebody's face. So the process we do is when we connect with them is we kind of try to walk the employer with, we need to create a list of who is probably your highest contact exposure folks, making sure that they are, also sent home, that they begin that 14-day quarantine, and then talk with them about, we can offer them testing for asymptomatic, understanding that it's not going to change the quarantine period, and then the timing of that testing, which we recommend between days 4 and 7, only because that is when we are more likely to find the virus if they're either going to be an asymptomatic carrier or somebody who's about to get sick. And then the other thing we do is make sure that they understand that once you identify a sick employee, you go back 48 hours before we knew they were sick and try to also see who they were around, because people can spread the virus for up to 2 days before they clinically are sick. So that's kind of become our main goal, is trying to help an employer identify who do you really need to quarantine and monitor.
Thanks, Dr. Cosenza. We're going to go to our last question, and I'm going to ask Angela to go first, and then anyone else that wants to weigh in. Okay, so now there's an exposure and the immediate needs are addressed. What safeguards do you typically recommend to an employer to reduce their chance of another exposure? Angela, can you start us off?
Sure. Thank you, Ruth. That's a great question, because that I think will help to set employers up for their best chances of having a successful venture through this pandemic that we're going through. But typically, the biggest thing I like to encourage is that employers look at the work conditions and try to find ways to help reinforce mask use, enforce social distancing as much as possible, whether that be potentially trying to alternate shifts to reduce how many employees are at a given location at a given time, or is there a way to create some more physical separation, somehow creating physical barriers, really trying to identify those areas in which they can create ways of improving social distancing, and then also by again encouraging and educating as to the use of masks, good hand washing technique, and leading by example with both of those things as well, and just promoting that education not only for themselves but among their workforce, and stressing the importance of implementing those things and working through different examples. So if you have to have something that occurs in person, what are the different ways we can ensure that maybe people are spaced out across a room instead of sitting right across from a table like they normally would have been, or if there's normally 4 workers in a truck, is there a way to reduce that so there's maybe only 2 on a shift and 1 sitting in the front and 1 sitting in the back? Or what kind of creative ways, taking each individual type of situation into consideration, what kind of creative methods can we come up with to help reinforce those recommendations?
Thanks, Angela. Dr. Cosenza or Dr. Passaretti, do you have anything that you think would be helpful to add to this question? Or Grady?
Well, yeah, yes, Ruth. I was just going to say, I think not to steal your thunder, but I think the digital COVID Safe for Employers resource guide that we have that's going to be coming available will be a really big asset for a lot of our employers to have on hand, that will help address some of these questions, how they can prevent an exposure, how they can manage an exposure, and how they can sort of follow up and prevent future exposures. So again, I think that will be a great resource that folks can turn to and utilize that information.
Well, thanks, Grady. Before we go to that, though, I think there may be some questions from the audience. Is that correct? Grady,
yeah,
did you have a question?
Actually, yes, there was a question, and following up on the mask, there's been a lot of questions about the mask and how to use the mask. But one of the questions was surrounding, if an employer decides to distribute masks to employees, what's the safest way to do that other than sitting a box out for employers to kind of put their hands in and grab maybe 1 or 2 masks at a time? Is there a safe way that you recommend distributing those masks so that there's not so many chances for contamination?
Dr. Cosenza, you want to take that, or Dr. Passaretti?
Sure, Ruth. What we would recommend is, it would be ideal if you could have somebody kind of monitor and make sure people wash their hands before they pick up a mask. Even ideally, if you wanted to provide masks and have them wear them in from home, they would have to just make sure that they're laundering their masks if they're the cotton or other material at home. But trying to make sure people actually wash their hands before they touch a mask, and then asking them to be very careful and only pick up one if there's a common box that they're being picked up from.
Thanks for that. But launder your mask from home, correct, if you're reusing?
Yes, they should be laundered daily.
Okay, thank you. All right. Any other questions, Grady, that you saw come in before we get ready to wrap up?
Yeah, there is one more that I'd like to put out there to the group. If someone can be infected through exposure to a cough or sneeze, why do we need to do a deep nasal swab for COVID testing? Some of the associates and employees are scared to get tested because of the pain and the discomfort. So Dr. Cosenza or Dr. Pazzaretti, could one of you guys answer that?
Yeah, I think, from the infectious disease standpoint, we're still learning what kind of specimen collection site is the best one to not miss cases. Currently, the information we have suggests that there may, in the not too distant future, be a reasonable alternative doing just the kind of tip of the nose swab instead of doing the one all the way back. It may miss a small number of cases compared to doing the nasopharyngeal, the brain tickler or whatnot, but maybe a reasonable alternative in some cases, especially if you're coupling it with making sure everyone's monitoring for symptoms. It's likely that deep nasal swab will remain the sample of choice for people with symptoms, but for exposure monitoring, or if there becomes a role for widespread testing, it's possible some more comfortable type of tests may be a reasonable alternative. There's, trade-offs no matter what you do, but maybe kind of good enough that it's a possibility in the future.
Thank you.
Grady, any other questions today?
I do have one more, Ruth. Can Dr. Pazzaretti or Dr. Cosenza provide some information about the risk of transmission of COVID-19 via hard surfaces? At the workplace, it seems to be impossible to constantly clean water fountains, refrigerator doors, coffee pots, and etc. And what's the likelihood of transmission from those surfaces?
So the primary mode of transmission is, the virus enters the body through the nose, mouth, eyes, most typically through someone, spewing virus into your general vicinity and, either coughing, sneezing, whatever. Surfaces can be contaminated with the virus, and the way that causes infection is you pick up the virus on your hands and then you touch your face or nose or eyes, and then the virus enters the body and causes the infection. So, I agree, you can't continuously clean something. You definitely need to clean those high touch surfaces regularly. But the best way each individual can protect themselves is through hand hygiene. So after you pour yourself a cup of coffee, you wash your hands, or you do you use alcohol-based hand rub, and really hammering that home with employees, and considering, like water fountains where people's mouths are all up on things. Is there a way to have cups present instead of, people using the water fountains or turning them off? There may be some considerations like that to take into place in the workplace.
Thank you. And Ruth, that's all the questions that we have. Great.
So then I'm going to spend just a minute or two talking about a new resource that we have coming soon. We've been sending out over the last 8 to 10 weeks information regarding everything from how to wear a mask to appropriate hand hygiene to overviews of symptoms, and it seemed to make sense for us to pull all of this information together and provide it digitally to our employer partners so that you had one place to go with the information that you need. And so within the next week, we should have available, and we'll push out to you, a digital resource guide has page numbers that will take you to specific information. We'll continually update it as we get additional learning from the CDC, from scientists, from Dr. Passaretti and Dr. Casenda and the team. As we add testing capabilities or new modes of testing, we'll add that information, but that way you'll have a single place to go for the most up-to-date information. In addition, we will also have some HR policies and practices, as well as some recommendations around high-risk employees. And then a lot of the infographics that we've developed will actually embed as links for you all so that you can actually print out or send directly to the employees that you're working with information that you want to remind them about, whether the proper way to wash your hands or how to wear a mask. So look for that. We'd love your feedback. If there's additional information that you think would be useful, let us know. We are going to also put some website links in there from reputable places to gather information, sort of like what Dr. Passaretti included in her presentation, so that it's easy for you to guide as the environment continues to change. So wanted to let you know about that. Have a look out for that. In addition, we're going to have another meeting on Wednesday, June 17th from 3 to 4 p.m. Again, that meeting will also be recorded. We'd love if you'd share this information with any colleagues that you have that might benefit from it. And if you need additional information, please email covid19rtw@atriumhealth.org, and we will make sure that we respond immediately. So with that, we want to conclude our discussion today. Thank you so very much for your time. Please be well and be safe, and let us know if there's anything we can do to help you.